years old man with severe acute cholangitis. So the history was, I think 3 years ago, he came here for acute cholangitis, and we were able to extract the stone. But now 3 years later, he came with the same problem, but with severe acute cholangitis, with grade 3 Tokyo, with kidney failure and low platelets. So it's here 11 o'clock p.m. So we'll begin our Ercp. So what is asked to do tonight, is to drain the CBD. The aim won't be to extract the stone, but only drainage. And I'm doing that tonight because we have, although the difficulty of the procedure, we have 3 years ago an Ercp. I remember I have done this Ercp, so we should have access, an easy access to the CBD, as we have a previous sphincterotomy done. So my purpose is just to put the plastic stand. This is our first duodenum, so I will turn a little bit my wheel, little wheel, and this is the second duodenum there. So I will lock my little wheel and will unloop and try to get my first composition. So this is the papilla there. We have diverticulum there. We should reach easily our CBD because we have the old sphincterotomy. So I will just follow the middle of the screen. The papilla is there, and we have done large balloon dilation for extract the stone. So this is our entrance. I am just in now, so it won't be a difficult Ercp. This is our CBD. I will just put a tray. I want to reach the upper CBD. So I will just pull back. شوية contrast. Un purge. So no sphincterotomy, no balloon dilation, nothing. We just will put, we'll switch to the fluoroscopic view. I will just put some contrast to see where are the stricture, where are the stone, etc. And I want to get with my wire, and we see this is the cystic duct we are in, I think. So I will pull back my sphincterotom here. هذيك الفيزيكولا. باش في الجيت. So I need to reach my so we see it clear. This is the cystic duct. I don't need it. ارجع شوية. So still in the cystic duct, and we see the upper CBD there. So still in the cystic duct, and my obstruction should be in the CBD. And we reach here our CBD. I think this is the left. So I will go there with my CBD. Inject شوية ترى. So maybe the cystic duct is here with this big stone there. So maybe it's not an acute cholangitis, but this is I think the problem is here. امشي في الجيت بتاعك امشي. اجبد امشي توا. امشي. امشي. So this is my cystic duct. امشي. And I have a big stone there. So what I will do, امشي. So I will leave this wire there because we will need to put drainage in the gallbladder here. استنى دقيقة شوية. I will secure and be شوية contrast راه. امشي. So this is the gallbladder. So I think we will need to put a stand there. Stop. به اجبد في الجيت شوية. اجبده. اجبد. خبي. امشي ترى. امشي. به خلي غادي كنكتمنا فيه هنخرج. So we will go back again now. I will pull back my sphincter tom. I will secure my wire there. And I will put another wire in the CBD there. So this is the typical aspect of Mirizzi syndrome. We see the large stone there, I think 5 or maybe 6 centimeter stone. أعطينا الإخضر. Deuxième fil guide, نحطوا les deux prothèses بعدين. So we changed now our approach. It was just a stent in the pancreatic duct. We see the blood coming because we have a low platelet here. So I will just put the other stent, the other guide wire in the CBD and try to go to the upper CBD and then put two stents, one in the cystic duct and one in the common hepatic duct. امشي ارجع امشي. So we are lucky we reach now the CBD. Stop. We'll put really some contrast there. شوية ترى شوية أبيورج. امشي بيورج. حضر لي بروتيز 10 فرنش هكا واحدة 10 فرنش نقول لك قداش. سي بون دقيقة. So this امشي injector. So we have a structure facing the big stone there. C'est bon. So now my next step will be to just have an idea about our stand. This. So the CBD stand should be 10 cm will be okay. نحطو 10 cm في البوا بليير و الكود كوشون شو عندك في الفيزيكول 7 فرنش و 10 فرنش 7 و 10. So we will put a 10 centimeter straight wire in the CBD. أي امشي. So 10 centimeter straight stand in the CBD and maybe 7 French in the cystic duct, but double pigtail one. أعطينا 10 سنتيمتر 10 فرنش نورمال للفوا بيليير. قداش هذاك 10 هذاك هو هذا القصير هذاك وحط نتاع 7 فرنش كزوز بجنبهم. دخل عطيت 100. So I will begin by the CBD now, 10 French, 10 centimeter. And for me, it's a Mirigy syndrome, stricture in the middle CBD facing the cystic duct, and a large big stone there in the cystic duct. So this is my sheet coming there. So the two wires are secured in the upper part of the CBD and the intracystic duct. في الجيد نهدر. نمشي. So the sheet is coming here, and we see the stand coming there. So I just have to push a little bit my stand, and the stand is going in. So my stand will almost be there. سيستم جبت أقعد هكاكا. So it's okay. So we have to be careful. I'm at the end of my stand. جبت كل شيء جبته. So my stand in the upper common hepatic duct here. So the first one is released. أعطيني توا. So we have the choice between the 7 French in the gallbladder. أعطيني double queue de cochon 7 cm عندك 7 French 7 French 7 French. So I will take now 7 centimeter double pigtail 7 French. استنى نمشي برا. وريق دانتوبيه okay. So we are almost done. تعطيني ماركور. اجا دور اجا. يتصب عليك حط غادي. حط لي توا هنا في الوسط حط غادي. سي بون واش بدا شوية. So the second stand is coming now. Double pigtail 7 centimeter, and the tail of the stand is almost 5 centimeter, maybe more. So I see my loop in the upper part of the cystic duct, just above the stone. So I need just to cross my stone there, and this is my stand coming. So I just will keep my wire there. I don't need to move it because I don't want to lose my access. I'm waiting for the marker I put to see where is my stand coming. I don't see my blue. I crossed now my stone, but I don't still see my الأزرق هو الطحب كله. شنو هذا هو. So we are here near the اجبد راه شوية في الجيد اجبد. So I'm releasing my stand there. I see my I see the tail of my stand, so it should be okay. Here, stop trigger. So my stand is okay here. There. I need to see the distal part. So is it okay here؟ اجبده بشوية، خلنا نجم نلقيها. اجبد سي بون. Okay. So our double stand is placed. We see the double pigtail in the double pigtail in the cystic duct just above the stone, and the other in the upper common hepatic duct. So I think we just, what you notice here, we didn't do any aggressive procedure and we have a bleeding. So that's why we are asked in Tokyo 3 acute cholangitis just to drain. We don't never need to extract any stone. So I will clean everything. قرب بتاعي قرب. attention عليك حمتاعو ياخو في دغدغي ولا حاجة، ياخو في دروغ ولا حاجة. اش قاعد ياخو في السرنج؟ هكا هو. سيف. So I think we can leave now. ربي معاك هو. So we see the air now, the CO2 in the upper CBD, so I think we can leave. I don't need to put another stent, maybe. I don't think it will help. I will just leave one stent, will be enough. I don't want to put another one. سجلت وسكوبي شوية. الكاميرا رحلة عنا ساعتين، فرش بها.